We're live on YouTube, but Dr. Samir Islam, our guest tonight on his own channel. Yeah, fancy that. Hi there, it's Matthew, and we're back for another round of a bit of a Q&A with you, and we've got a few things that we want to address tonight. So
Let's
if
do it.
you would like to know about stress as it relates to the gut, anxiety, travel, work pressures, we're going to talk about that tonight. Plus, we're going to unveil something called silent reflux. So first up, lots of weather in Lubbock, Texas right now. What's the situation there?
Matthew, it's like Snowmageddon here. Like everything is shut down, and rightly so because Lubbock and Texas, they do not handle snow at all. And not only do we have a little bit, we have a lot of snow. So schools were shut down. We have delays, but everyone be safe. Drive slowly. Don't go crazy. It is the weather is bad, and there's a reason why we need to drive slow. Also, Matthew, I want to give a shout out to my TikTok audience. If you guys are watching on TikTok, let me know your questions. We'll answer them towards the very end. So hello to my TikTok audience. Hello to YouTube. And Matthew, thanks for hosting this, bro. Let's get this going, man. I'm excited.
Yeah, me too. Because look, there's a lot of people who are starting to draw that straight line between stress and it relates to the gut. And I know you've been talking about it for years, but I want to talk about three things specifically. Work pressure. When the job is just grinding you out, and you start to notice has this impact on your gut. I want to talk about travel and why it seems like when we go on trips, either we don't poop or we poop more. And then there's anxiety, and that seems like the best place to start because it's probably the biggest group of people. But what have you learned over the years about the relationship with anxiety and our gut?
There is a direct relationship, and people really underestimate the impact of stress on the gut. So I like to think of this as like a love triangle, Matthew. So there is a love triangle between your brain, your gut, and your gut microbiome. If any part of that triangle is not working properly, it's too excited, if there's too much going on, it will affect how your gut feels. And the biggest impact is stress. And with what's going on with the world, with people seeing things on the news, there's no doubt that people are stressed more. And I'm seeing this in my clinic as more and more people are coming in for gut issues that's directly related to how they feel when it comes to stress. There's a direct connection.
You know, what's so interesting, though, is it seems like a vicious cycle because you get stressed out and your gut is not great. And then you're like, well, I just need to stop being stressed out, which actually stresses you out more.
Yes.
What role do meditations or prayer or breath work play in this? And then what role does a medication play in this?
So it's all about what's called the vagus nerve. So the vagus nerve is one of the biggest nerves in your body. It helps to stimulate what's called the parasympathetic response. So when you're stressed and you feel anxiety and your gut is stressed, you feel more anxious, and someone tells you, hey, chill out, you feel even more anxious. What happens is that you go into a flight or fight response. And so it ends up just being this vicious cycle. You are right. And so our goal is to break that cycle by stimulating the vagus nerve. And I will tell you some of the more effective natural ways that has shown in so many studies are things that you mentioned, whether it is deep breath, meditation, prayer, going for a walk, exercising, finding friends to communicate. Whatever your thing is that will get you de-stressed, use it because it works. Now, for some people, they may be so stressed out or they get into this vicious loop in their head that they need more professional help, maybe medications or seeing somebody to help them out. And that's okay. But the evidence for doing non-medical therapies like meditation and prayer work, I do it myself. So for me, with my job, as being a doctor, being a father, being a parent, running a business, I have stress. I'm sure you do as well. And so I incorporate meditation, prayer, exercise, silence, going for walks. And I cannot tell you the impact this has had, not only with my stress, but minimizing my own gut issues as well.
I want to make sure everybody knows that you can get in contact with with Dr. Islam at Lubbock Gastro. That QR code that we're going to just leave up in the top, you can scan that. It takes you straight to the appointment page. So we'll make it super easy if you feel like you need to get in touch with them. Do anxiety medications then, is that something that you will typically prescribe to somebody, or do you prefer that to come from like a psychologist or a psychiatrist, or what's your feeling on that? Because it would seem like if we can get the anxiety under control, maybe the gut gets under control, but maybe it's the other way around. I don't know.
Yeah, it's actually both. So, what happens when people have a lot of stress in their gut? A is that direct connection, that super highway between the brain and the gut, but also your gut actually increases the sensitivity of how it feels as well. So what you feel maybe normally as pressure, someone who has a very hypersensitive gut may feel that as really bad abdominal pain. And so our role is that we could actually use medical therapy, sometimes antidepressants or anti-anxiety medications, to turn down that volume. It's like the volume is turned way up, we can turn it down. And sometimes I'll prescribe these myself at very low doses. Sometimes I'll get the help of our psychologist or psychiatrist, maybe our primary care physician. So anyone can delve into this. And so for a lot of my patients in which anxiety is playing a direct role with making their gut issues worse, they need help, I will prescribe medications that can turn down that volume, and patients are surprised how much better they feel, not only with their stress, but their gut issues go away. It's because we're really directly connecting and breaking that cycle, that vicious cycle between the brain and the gut.
If you just joined us tonight, we're talking a lot about how stress impacts our gut. And if you have any questions, please feel free to put them in the audience. I know you got your TikTok audience going with you as well, so that's cool. It seems to me like anxiety in the gut feels like this chicken or the egg conversation. Like which one comes first? I mean, how do you know if it's anxiety, and how do you know if it's the gut?
You don't know. And that's the thing, is that we just don't know. And it may be both. And I will tell you, for most of my patients, it honestly is both. Because you gave a very good scenario. You get stressed about what's going on. Your gut acts up. You get stressed about your gut. You get more stress. So it ends up being a vicious cycle. You're exactly right. And this is the drain that, you're circling the drain when it comes down to this. So it doesn't really matter which one is the chicken or the egg, because I treat both. And so I'll tell patients, we have two options to kind of really hone down and get you feeling better. We have the non-medical options. So find what works for you. If you pray, go pray. If you need meditation, do it. If you're going to exercise, do it. Find ways non-medically to get you feeling better, get you de-stress. And we also have the option of giving you medical therapies, and we'll do that. So sometimes we'll give both treatment options, and irregardless of which one's the chicken or the egg, I will treat both to get you feeling better, because my goal is just to get you feeling better. And if I can't do it, sometimes we'll do the referrals where we have you see a psychologist, a psychiatrist, a counselor to give you more professional help that I can't give.
Okay, fantastic. Let's move on to talk about travel. I'll just call myself out. It's strange to me, but when I travel, I don't poop. It's a really weird thing. But what is it about travel that shakes up the gut for us?
So I'll tell you, Matthew, you're not alone. And okay. Listen, man, I'm the poop guru. I'm like all about the poo. It happens to me all the time. Every time I travel, I get constipated, and it just ends up being what's the case. So here's what's going on, is that when you're traveling, keep in mind, you're having a different environment. You're having a different rhythm. You're eating different foods. You're having different altitudes. You're waking up differently. Your body thrives on rhythm. This is like one of my big pillars when it comes to GI health. Rhythm, 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 rhythm. And anytime you break up that rhythm by traveling, you are interrupting the natural process of how you use the restroom. A lot of people can manifest that as constipation. And it's just the natural course of what happens on. Now, other things that play a role, if you're traveling on a plane, altitude can change how your body moves things along. If you're eating different foods, you're not drinking enough water, maybe you're indulging in some of the niceties of vacation. Maybe you're not as strict with your diet. All these things play a role, but the biggest role is just the lack of rhythm that your body is normally used to. And you have to try and get yourself back on that rhythm to get you having, better bowel movements and not be so constipated or having other issues as well.
Okay, sounds good. For those of you that have just dropped in, we're talking about stress and how it relates to the gut. We're also going to get with Dr. Islam tonight about something called silent reflux. But we're talking now about, let's move on to work pressure.
Yeah.
It's real for you know, and you just talked about it, right? I'm a dad, I'm a father, I'm a husband, I got my business, I'm trying to work out every day. So work pressure can relate to the gut. How do you see work impacting people's guts?
Well, I think a lot of it has to do with how you manifest your symptoms when it comes to work. So there are a lot of patients, and a lot of patients come to see me who are in very stressful jobs, whatever job it is. And that stress of having to deal with that work, 8 to 10 hours a day, you're spending most of your time at work. And so it means that your body is in this flight or fight response. And that will cause your body to react like it's always just on all the time. And people can manifest that as, I have worsening abdominal pain, worsening GERD, I can't use the restroom, I use the restroom too much. And it's that stress that you feel from just all that work and the pressures from work that will get your gut working crazy to make you not feel good. And so it's that direct connection between what's up here and how you feel inside your GI tract.
You know, a lot of people right now are doing this thing that the old expression is burning the candle at both ends.
Yeah.
And it would seem to me, and this is one of the things that I noticed for myself, and I'd be curious for those of you who are watching with us tonight, if you experience this well, you can just drop a line in the comments. But like, when I don't get a lot of quality sleep, let's say one night I'm only going to get like 4 or 5 hours of sleep for whatever reason, man, I feel like a tossed salad in my stomach the whole day. So I wonder if anybody else feels that. Why is it? Why is sleep so flippin' important to our gut health?
Yeah, so sleep is the foundation for everything. Not only for your gut health, but it's the foundation for brain health, heart health, weight loss, obesity. It literally is like the biggest leverage you can do when it comes to improving your health overall, including your gut health. And so I'll tell you what I tell my patients when it comes to sleep and making sure you optimize sleep. I'll tell you what I do myself. I Work will always be there. I mean, we all know this. There are thousands of things that we can always do when it comes to work. Work will always be there. We always have things to do, but you have to prioritize sleep. And so I tell my patients, and I'm going to tell you, you need to become a professional sleeper. As serious as you take being a dad, as serious as you take your work, you need to take sleep just as serious, which means you clock out of work and you clock into sleep at the same time. You start a ritual of making yourself sleep. And that means turning off the lights, getting off your phones, getting off of blue light, making sure you have a cool environment. To get ready to go to sleep by either having a warm shower or warm bath, have some sort of ritual. Have a very dark room. Keep it very, very cool. And to make sure that whenever you are sleeping, you do something relaxing, whether it's reading a book, reading something that's pleasant, not being on your phone, not watching TV. But the biggest thing you can do is becoming a professional sleeper. So I made this commitment to really prioritize my sleep. Let's say it's towards the end of 2025 and 2026. So I thought, man, I am just not, something's like off. I'm more irritable. I'm just tired all the time. I don't have as much energy. So I really committed at the end of 2025 to really just professionalize my sleep. And I cannot tell you how much better I feel, how much less, just less angst I have, the less short-tempered I am. And I'm a complete believer now in doing everything that you can to optimize your sleep, because it is such a huge leverage when it comes to how you feel, how your gut feels, how your health feels, how you look. I mean, there's literally nothing you can do better for your health besides improving your sleep and exercise. If you do these two things, I will tell you, you are like 80 to 85% better than anybody else out there, and you will feel amazing without any medications, without any drugs, or anything else. It's been a game changer for me.
That's such good advice. I wonder how many people watching right now feel like they're a professional sleeper. Drop a little thumbs up in the comments if you feel like you're a professional sleeper. Drop a thumbs down if you're like, I need to get to work on being a professional sleeper.
You really do.
It's
really set those rules. It's hard, but you got to set these rules because it is literally the biggest leverage you can do for anything in your life. It really can. And there really is no value in getting up early and staying up late because your work quality sucks. It just is not good. And so if you can really hone in on your work hours, do deep work, do effective work, and then once you're done with work, stop and then become a professional sleeper. I am telling you, your work will be so much better and you'll get work done faster, better, and you actually have less work than what you normally do. I actually work less now, I'll be honest with you, than I did before because I'm actually able to get more done in a shorter frame of time and have that work be so much better. So I'm just going to go on and on about this unless you stop me, but I love the idea of becoming a professional sleeper.
Such good advice. Okay. Let's switch gears a little bit. And still to come tonight, I want to have a conversation about let's say your top 3 or your top 4 essential tips to live by for gut health. And I'm guessing one of them is sleep. So we'll spoil that right now. But
yes.
That's something I want to talk about. If you don't mind, I want to ask you a question about something that I've recently encountered. And I'm doing this in hopes that somebody is watching this right now who's got the exact same thing happening. And they're like, yeah, bro, what is this? So lots and lots of phlegm, just kind of always clearing my throat. And what I've noticed is in the last 4 or 5 weeks, I've started to become a little bit more like indigestion and like heartburn symptoms. And it's really fascinating to me because I can't seem to calm down the I can't sing in church, Doc. So you got to help me out here because I'm trying to make a joyful noise and I can't because I'm clearing my throat all the time.
Yes.
What is that? Does that sound like anything you know?
Yes. Like Matthew, this is like my clinic. This is like literally like my clinic I see every single day. So the medical term that you're suffering is called globus, globus. It's this sensation of a frog in the throat. You have something in your throat and something's going on there. And one of the more common reasons is something that I see called silent reflux. Now, Matthew, let me ask you a question. When you hear reflux, what are the typical symptoms you think about when someone says, "Oh my goodness, I have reflux" or "I have GERD"? What do you feel like that what symptoms are they talking about?
Yeah, like heartburn, like just kind of an indigestion here in this part of the chest.
Exactly right. That's exactly right. And that is the most common symptom from what's called GERD, gastroesophageal reflux disease. It's the symptom of heartburn, indigestion, or regurgitation. But then you have this other spectrum called silent reflux, where acid actually goes up into the upper GI tract, but it doesn't present as heartburn or regurgitation or indigestion. It presents what you described, globus, the sensation of, I got to clear my throat. Or maybe the sensation of, I have a frog in my throat. Or maybe you have chronic asthma. These are atypical symptoms of acid reflux. So you actually may be having that silent reflux in which acid's going up into the esophagus, affecting what's up here. And you don't feel the heartburn, but you actually feel the other symptoms, such as the throat clearing. And it's a very common symptom that I see every single day.
I feel like it just showed up, and truth be told, and other people are experiencing this too in the world, there's a little bit more stress and anxiety going around right now. And is that something that stress brings on, or is there some thing happening within the body that I need to be medicated for?
That's a great question. And to be frank with you, it could be all the above. So the most common reason why people have either a reflux or a silent reflux is the valve between the esophagus and stomach called the lower esophageal sphincter. This is a doorway that keeps acid in the stomach when you're not swallowing, and then it flips open whenever you do swallow to allow acid to go down. Now, for a lot of patients, that door flips open too often, and that's when they get the heartburn, regurgitation, and the silent reflux. What causes it to flip open? It could be food, it could be gas, it could be a hiatal hernia, and it could be stress. Stress can cause that valve to flip open to cause worsening acid reflux. So yes, stress can make those symptoms worse, and the reason it's worse is because that valve is open more often and longer to cause more acid to come up to cause these symptoms to occur.
So how do you typically help people through this? What is your protocol? Is it like, is it a dietary change? Is it?
Excellent question. So I tell patients, number one, this is multifactorial, meaning it may not just be acid. So we have to rule out other things. Is it postnasal drip? Do you have a lot of allergies? Do you have problems with, maybe there's an infection going on in the chest? Maybe it's acid reflux. And so I stress to patients it's multifactorial. Sometimes it's multiple different things. Maybe it's things with anxiety as well. So my role as a GI doctor is to see, is there a GI cause? So the first thing I do is lifestyle changes when it comes to reflux. So let's do this. Let's minimize these foods that make reflux symptoms worse. Tomato-based foods, chocolate, coffee, the things we all enjoy. Minimize that for a couple weeks. I know, but just do it for a couple weeks, see how you do. Number two, I tell patients, try a trial of what's called a PPI or proton pump inhibitor. You can get these over the counter, do it for about 2 to 3 weeks, see how you feel. If you do better on the acid medication and your symptoms go away, boom, there you go. Now you know that acid's playing a role. If you don't do better, it doesn't necessarily rule it out, but at that point in time, you may want to see someone like me, in which we can do objective testing to see how is that valve working? Is it truly acid? What is going on? But at least if you're at home, lifestyle changes, a trial of an acid reducing therapy, see how this works. If it works, you have your answer. And if it doesn't work, then we can maybe do a further investigation to see if acid is truly playing a role or not.
Okay, for those of you that are in Lubbock and would like to go see Dr. Islam, that QR code in the top will take you straight to their appointment page. And, look, I hear you all the time on YouTube and TikTok, and, usually say you can get people in within a couple of days. So if there's something you're dealing with.
24 hours, Matthew. I want to stress this. We can get you in that day. Don't worry about it.
I walked you right to that. I want to kind of start to wind down our conversation with sort of your essential tips to gut health. And for people that are, stopping by the YouTube channel and are watching this right now, I'm sure there's some like low hanging fruit, but then I think what people are interested in is like, what does the doc really know that he doesn't share with anybody except his closest friends and his family? Maybe there's nothing there, but your essential tips to live by for gut health, what do they look like?
So we talked about one, which is sleep. I think people truly underestimate the importance of sleep and gut health. We know on studies that the worse sleep that you have, the worse GERD, worse heartburn, worse irritable bowel syndrome, worse diarrhea, worse constipation, worse colitis. We know that sleep plays a central role with that. So that's number one. Number two, I think people underestimate the role of stress. And we talked about this, in the very beginning, but stress plays a huge role. And if we don't find ways for us to manage our stress, that, it can make things worse. So for me, we'll go to number three now, movement. And so movement is key. So what I do personally, I tell my friends this all the time, is that I combine two for one. I exercise and I do cardio and I lift weights. That helps me out with movement and helps me out with stress. So I'm killing two birds with one. And this is something I truly, truly, truly believe in. And then lastly, food really is medicine, but it's got to be the right food that gives you the right medicine, which means that you have to prioritize lean protein, prioritize fruits and vegetables. And my recommendation is hard, but if you can do this on a consistent basis for every single meal, you will feel so much better. So I've done an experiment, Matthew, since I think October of 2025, where I wanted to just try and see what it would be like to eat basically the exact same meal every single day. I just want to try it. I want to try this to see how this works. I've heard people do this. And I'll tell you that for me, this has made one of the biggest gains in my gut health. Now, overall, my gut was doing great. I felt fine. I felt good. But, as you get older, you're like, I don't have as much energy. I'm not looking as lean as I want to be. Things are changing. So I thought, let me do a radical change. And I did it starting October. And I can tell you we're about 4 to 5 months in now. And I feel better. I have more energy. I've lost significant amount of body fat. I'm a lot more, I look good and I feel good. And it's because I made that difference of really honing in on being even more consistent with what I eat and using food as medicine to make me feel even better than what I was feeling before. So if people can do this, and it's things I tell my friends all the time now, it's been a big trigger for making me just feel even better than what I was feeling before as I'm getting older.
Can I ask you a question quick about since we're in the food lane right now?
Yeah.
What role does some of the fasting diets play on our gut health?
So we know that fasting does help out when it comes to a lot of GI issues, when it comes to improving the gut microbiome. We know that it can improve gut health. We know it can make you feel better. But also, do we know that fasting has been around for centuries? It's part of some of the ancient traditions that we have. And every
Not always
single
on
major
purpose.
religion, no, you're right. Not always on purpose. And it may have been a reason because we didn't have a lot of food. But there's a
Yeah.
reason we also evolve towards that as well. We have gotten now to a society where food is everywhere. And we've gotten to a point where we're just eating all the time. And there is value in restricting what you're eating, whether it's through fasting, whether it's through intermittent fasting, whether it's fasting for 30 days during special times like Ramadan, whether it's maybe not eating as much as you normally do. There's been so much value in terms of just restricting how much you eat, that I'm a big proponent of this in any way that you can. Whether people like intermittent fasting or just restricting calories or not eating where you feel so full all the time. There's a saying that I try to give my patients is that you want to have your stomach to be 1/3 full of food, 1/3 full of water, and 1/3 full of air. And if you can do that, that is the best way to improve your gut health, but also to feel better and just not feel so gluttonous all the time.
Yeah, interesting. Okay, well, thanks for getting on that tangent. So, in terms of the essential tips for great gut health, you mentioned sleep, you mentioned managing stress, you managed movement and exercise, you managed eating the right foods. What's the fifth component to having great gut health, and something that you do for yourself?
So one thing obviously is just to make sure you do everything preventive wise. So,
Mm,
prevention, an ounce of prevention it can, obviously can give you so much cure later on. And so if you're having issues or if you're due for your routine testing, get that done, because there's no amount of diet, sleep, or stress that's going to stop colon cancer if you don't get your colonoscopy done. There really isn't. And if you are due for your routine visits, your routine care, get it done, because you can do everything right with the other four pillars, and you miss that last one, and you can end up having something bad going on inside your body, whether it's colon cancer, colon polyps, esophageal cancer, bad gut microbiome, things like that. So it's all tied together to improving your gut health. So you have to make sure you do every one of these things.
okay, super. Well, look, we've got about 3 or 4 minutes left. I want to give anybody on your TikTok channel a chance to ask a question. I also want to open this up to the YouTube audience that's watching us right now. Is there something that you've always wanted to ask either Dr. Islam or GI docs in general? This guy is Mayo trained. He certainly knows his stuff. And will, as you can see, he's got a great way of explaining these things. And I'm so glad that we do these little Q&As together, because I just know there's so many people out there that are wondering the same thing. Like, hey, this is happening
Yes.
to me. What the heck do I do with it? And so the
Yes.
essential tips, just to go over them one more time: become a professional sleeper, manage your stress, make sure you're moving, eating the right foods, and take care of all your preventative testing on the way up. Any questions on TikTok that we need to
Yeah,
address?
so there's a question from Manusha. Manusha, thank you for doing this question. Great question. So one question is, can menopause cause silent reflux? And I think it's an important question because you know, people go through menopause. So
They
menopause
sure do.
affects, yeah, absolutely. Menopause affects the entire gut. Your gut hormones are manifested and regulated by what's going on in terms of your body. And whenever women go through menopause, it absolutely can affect your GI tract. It can make you more constipated. It can cause more bloating, more diarrhea,
Mm.
more heartburn symptoms, because the change in the gut hormone balance, which can change your gut microbiome. So what do we do about that? Well, obviously, we have to find ways to see if we can manage menopause, and there's some medical therapies for that. Sometimes dietary options can help minimize the symptoms. So improving your gut microbiome, adding more fiber, adding more fruits and vegetables, eliminating red meats, adding more lean meats can help out. Adding in fiber is critical when it comes to patients who are undergoing menopause, who have GI issues. And it's very important to incorporate fiber slowly and over time, because too much fiber will make things worse. If you do this will help minimize some of those symptoms, including silent reflux when it comes to menopause. So it's a great question we got on TikTok.
Yeah, that's incredible. And there's so many things we're finally learning about menopause. And I feel like there's been this awesome awakening to menopause, and rightfully so, right? Half
Yes.
the population is going to deal with this. And so it's so cool that we're learning more and more about it. Are there any other impacts of menopause on our gut health?
Yeah, and so we do know that menopause can also affect, how the motility is in terms of your GI tract. So for a lot of my patients who are undergoing menopause, their bowels may slow down, their bowels may speed up, their their bloating may get worse. Bloating is a very common symptom that we get with menopause. A lot of it has to do with the changes in the hormone balance that occurs, which affects how the gut metabolizes food, but also going to affect how the gut moves as well. The less your gut moves, the more stagnant it becomes, the more gas it gets produced, the more bloating that we have. So bloating is such a common symptom for my menopause patients.
All right. Any other questions on TikTok? Otherwise, we're at 30 minutes and we'll let people get by and get back to their days or their evenings or their mornings, whatever they seem to be watching this back. Any other questions you want to cover?
No, I think we got everything on TikTok. Guys, thank you
Awesome.
for watching on TikTok, and thank you guys for watching on our social media channels as well.
Yeah, thanks for doing this. And I think we're going to try to do this every couple of weeks. So, get your questions ready and bring them to the table. This is a fun way to get about it. Dr. Samir Islam at Lubbock Gastro. That QR code is up in the top left. Please just hit it right now and you'll be taken to an appointment page and you can get seen, as he said earlier, sometimes within 24 hours. So, all right, what's your plan for the rest of the night? It's late there. There's weather in Lubbock. What is the wind down strategy for Dr. Islam?
So I am going to do my ritual. I'll tell you my ritual that I do. So as soon as I'm done, I am going to go to my bedroom, take off my contacts, wash my face. I write in my journal for about 15 minutes. It's part of my meditation decompression time, and it's been a big difference for me. I go to my bed. Obviously, I say goodnight to my kids and my wife. I actually go to bed early because I wake up early. I read a fiction book when I go to bed for about 30 minutes. That reading that fiction book just decompresses my mind. I don't have any podcasts on. I don't have any social media on. My phone is away. I turn off the lights. I have it at 63 degrees. It's cold, but I love it.
Woo!
And with it, I know it's super cold, but with this ritual, I am able to go to sleep, sleep like a baby, wake up with so much energy. This is my ritual whenever I try to go, and it works great.
All right, fantastic. We'll let everybody get about it and have a great night. We'll see you next time. Thank you, Dr. Islam.
Thank you guys. Y'all have a good night. Stay safe.